Hello friends, let's today talk about hip arthritis. So basically, whenever there is wear and tear or inflammation in the hip joint, that is called as hip arthritis. Normally a hip joint is made up of two components. One is the ball component and the other is the socket component. The ball component is made up from the femur bone ball, and the socket component is known as acetabulum. So normally they fix well into each other, and without any pain, movement takes place. But whenever there is a cartilage related issue, like the smooth cartilage that cushions the bone, it gets worn out, then it can lead to hip arthritis. Symptoms of hip arthritis would be like pain, stiffness, and reduced movement at the hip joint. Now, when we talk about the causes for hip pain, the most common reason is osteoarthritis or age-related arthritis. Just like we get arthritis in the knee joint, we can also get arthritis in the hip joint. Second most common reason is avascular necrosis of the femur head, in which the bone supply to the femur head or the ball part of the hip joint reduces, and it leads to collapse and consequently arthritis of the hip joint. Third most common is inflammatory conditions like rheumatoid arthritis. Sometimes arthritis can happen after a major accident also, like hip fracture or dislocation or cartilage defect. Rarely it can happen in situations like infection of the hip joint. It could be because of tuberculosis or other form of joint infections. Some other rare causes includes conditions like ankylosing spondylitis, gout, or developmental dysplasia of the hip joint. Now, whenever a patient is suffering from hip arthritis, the most common symptoms that the patient may get is pain in the groin. That is, front part of the hip joint may become painful. It can radiate till the thigh, or sometimes it can radiate up to the knee also. Second most common reason is whenever the patient gets up in the morning, there is stiffness in the hip joint. Patient will find it difficult to walk. There might be a frank limp also. Climbing stairs becomes very painful. Also, the movement of the hip joint overall reduces. Like if you want to sit like this on a sofa with your leg folded, that can also be very painful. In later cases, whenever there is a collapse of the bone, there might be a limb length discrepancy also. That means one leg may become shorter than the other leg. So whenever we are faced with this situation of hip arthritis, treatment is always non-surgical to start with. We first start with medicines like pain medicines, muscle relaxants, or anti-inflammatory. We ask the patient to join physiotherapy and do exercises. Lifestyle modification also helps like reducing the weight. Or patient should avoid activities like sitting, cross-legged, or squatting. Later, as the disease progresses, we might ask the patient to use a walking aid. In situations where things are not improving in spite of good physiotherapy, medicines, and weight control, then we can ask the patient to go for hip replacement surgery. Normally in hip replacement surgery, we change the damaged part. That means we change the ball as well as the socket. So medically we can say we change the damaged ball, which is the femoral head, by one component, and we change the damaged socket, that is the acetabulum, with another component. There are various types of hip replacement prosthesis available. Normally, a hip replacement surgery takes around 2 hours and patient needs to be in hospital for 3 days. So if you are suffering from hip arthritis, don't worry. Visit your doctor. He'll try to find out the reason for a hip arthritis, and whatever the reason is there, he will treat you accordingly. All the best.